Hello everyone, I am Dr. Dinesh, consultant nephrologist and transplant physician, Sparsh Hospital, Infantry Road. So recently we celebrated World Kidney Day, that is on March 13th. Every second Thursday of March every year we celebrate World Kidney Day to spread the awareness of kidney health. Kidney is a bean-shaped organ which is 9.5 centimeters to 10.5 centimeters, which is present on either side of the spine, below the ribs, which keeps on working 24 into 7 when you're sleeping, when you are working. So we have to give more important to our kidney so that the overall heart health, bone health, and blood is properly managed in our body. So today on this World Kidney Day we will know what is important functions. So everyone know the kidney removes the waste, blood, urea, toxins from the body. It also regulates excess of water from the body. So when you go to the desert, it tries to conserve. When you go to a cold place, it removes the excess water. There is a kidney also regulates, keeps homeostasis of sodium and potassium, is required for the conduction of nerves and contraction of muscles of heart or any muscle in our body. Kidney also regulates the calcium and phosphorus. Calcium is reabsorbed from the kidneys by the activation of vitamin D, which happens in the kidneys. So it is required for the bone health. Kidney also removes excess of acid from the body. Our body produces more of acids, has to be removed from the kidneys. Kidney also produces called erythropoietin, which is required for production hemoglobin or hemoglobin in a normal range. So these are the important functions of the kidney. So how to protect this kidney? To protect this kidney, first important to know is the risk factors. See, the hypertension and diabetes are the most important risk factors for kidney disease. This constitutes around 60 to 70% of ESRD. So if your patient is a diabetic, make sure his sugars are well controlled and is follow up with the physician. Bring down HbA1c less than 7 to 7.5. If he's a hypertensive, make sure your BP is less than 130/80. So there is decreased pressure on the nephrons and less chances of kidney damage. Hydrate yourself well. There's a condition called CKD of unknown origin, where the people from Andhra Pradesh and Sri Lanka, they come to us with this bilateral small kidney and advanced kidney disease. This probably one of the risk factor is dehydration and inadequate intake of fluids. So hydrate yourself so that the toxins are washed out, and also prevents excess risk of stone as well as infections in the kidneys. I have a balanced diet. Try to take a balanced diet. Avoid junk food, excess of salt, and saturated fatty saturated oils in your diet. This puts less pressure on the kidneys. Also, this helps in preventing complications such as metabolic syndrome, hypertension, and diabetes. So have a balanced diet. Avoid smoking and alcohol. Smoking again causes vasospasm, leading to ischemia and damage. Hypertension causes nephrosclerosis. There is a nephron where there will be pressure, and this leads to nephrosclerosis. So alcohol in fact causes dehydration, and it's a chemical which increases the blood pressure. So try to avoid smoking and alcohol. Try to avoid taking a painkiller for long time, because a long duration of NSAIDs like ibuprofen and nimesulide again puts pressure on the kidneys, and this can again cause damage to the kidneys. So these are the risk factors, and make sure you try to avoid the risk factors. Simple way to prevent the kidney disease is detecting it early stage by doing a simple test like creatinine to know your kidney number, ultrasound abdomen to know how is your kidney size, textures, or any anomalies. Urine examination like urine microalbuminuric urea test, where early we can pick up any protein loss in the kidneys and start on kidney protective medicines. So make sure you take care of kidney and your life. Otherwise, if you neglect kidneys, then the life might neglect you.